How's it now?
Perfect.
So I'm just going to share my screen.
Yep, great, thanks.
Hey, can everybody see my slides?
Looking good.
Okay, thank you, Leah, and also the organizers for the opportunity to present. As Leah mentioned, we are the Data Working Group, and what I'll talk a little bit about is our history, what we accomplished, and our call to action. So we were formed at the last 2019 summit, this summit on redefining the future of healthcare. And the goals of, at the time, what we found the gap in is about understanding what it means for patients to own and access their data. In addition there's several people are becoming data aware, and people are understanding how important health data is in the decisions about your health. The challenge is to acquire that data. And also with the system being so fragmented, there's many stakeholders who are vying for your data. And so what rights do you have and what obligations do they have in terms of your data? So that was the focus. And then, excuse me, and then our goal of a committee is to come up with a declaration of individual health data rights and obligations in Canada. And so this is quite broad and quite general, but we wanted to put it out there, and then the goal is to socialize this declaration and get buy-in for the community. A bit about who's on the working committee. I mean, there's myself. We have Jennifer Graham from the Canadian Congenital Heart Alliance, Louise Binder, as you know, Eric Sutherland from Kai participated until he had to be he had abstained for other work, but we appreciate his contribution. And we also have Leah, and Leah's done. I want to put a shout out is that a lot of the heavy lifting and a lot of the writing was done from her. So I do appreciate all the work that she's done. And so when we started the group in January of this year, we met monthly, and we had a process that accumulated to a draft copy. So the first thing we did was we investigated the current landscape. We looked at the Supreme Court ruling, the laws and regulations, like obviously PIPEDA, and also the provincial laws and privacy. We looked at there's an Ontario Privacy Commission ruling on access. And then we went abroad, especially to Europe, to understand GDPR and what rights that they've implemented in their rulings and the laws. Then we also looked at the Naylor Health Innovation Report and their findings related to health data. We also have the PAN Beacon Report. And once we collected this information, we started drafting the declaration. And then we expanded this out to get consults with health lawyers as well as privacy experts. In about September, we had the draft ready where we socialized it with a close set of stakeholders to get their feedback. We digested the feedback, and now we're ready to socialize it to this audience here. And our goal in the coming months is to, one, receive feedback from the draft declaration. We would like to seek endorsement from this audience at the summit. And then we want to publish the declaration to custodians. I'm sure there's going to be a bit of a conversation with many custodians, but at least we want to have a position of where we feel we stand as patients, caregivers, as well as patient organizations. The draft declaration is quite detailed, and so there's 11 sections. And I think I would summarize it in this way. We want to create awareness and control, awareness that you have the right to your data, and also that you have control of your data, which is in other people's hands. You also have access and access and acquiring your data in a usable format. So that's very important. Often as a caregiver, and many of you know, is that we carry around binders of paper, which is very low utility. In Europe, you have the right to acquire your data in a machine readable format because it increases the utility and portability. You also have the right to restrict on how it's used, who it's using it. And so these are some things we touched upon, but we also looked at the obligation to share the data. So we looked at a balance to make sure that we don't impede progress in either policy or research. And for example, we had a debate on retroactive rescinding of consent. And technically that's very complicated. And so we look at, from this point forward in terms of your obligation to share and your rights. So what we'd like to do next is everybody should have a copy of the declaration, but if you don't, please contact Leah or myself. And we want to socialize this, receive feedback, and then we'll incorporate that, have a dialogue. It'll be an iterative process. And then we're looking at in the new year to publish the endorsed declaration. Or I should say we want to publish the declaration and receive endorsement. And that's a short presentation. So we didn't go into the details of the declaration just because it is quite lengthy, but here to answer any questions.